Hey guys, it's Alex here at the Physio Lounge, one of the physiotherapists. I just want to answer a few questions at the beginning, and one of the questions we're getting a lot about is the use of ice and heat. Both have different purposes and different sort of timings that you should be using them for. However, they both have the same application time and the same application technique. You want to be using it for about 15 minutes, both ice and heat, whichever one you choose to use. I'd recommend making sure there's some sort of fabric in between yourself and the source of temperature cause. So whether it be ice, make sure you've got sort of a tea towel in between because it can make the skin very dry, or heat, make sure you've got a tea towel or some fabric in between to make sure it doesn't burn your skin. When it comes to the time of application, ice I would recommend to use after any sort of activity or acute injury. So if you sprain your ankle and straight away you notice some swelling, I'd get some ice on it and elevate it and rest it as best as you can. If you're having swelling recurrently, after like when you're doing activity, if you've got like an ankle swelling that keeps coming back, I'd be recommending after you've done anything like a long walk, been to work, done anything sort of activity based that causes that sort of swelling to happen, I'd make sure you get some ice on it straight away, just to prevent that swelling building up at all. With heat, I'd usually be using it to try and relax any muscles that may be overworking. You usually tend to use ice on the sort of distal muscles like ankles and knees and wrists, and you're probably using heat on areas like your back and your neck, as those are where muscles usually tend to be overactive and swelling usually tends to happen the more distally in sort of your ankles and feet. So if you've got any questions or concerns, you're not sure how to do it, please come into the Physio Lounge and we're more than happy to help you out.